in many respects. I'm very pleased to be able to present to you Dr. Schmidt, our medical director, and she is the first one who will speak to you. And then Veronica Müdiger, which I just call her Veronica, the last name is a little bit difficult. And she's our marketing specialist, and she developed this brochure here and helped us a lot in just having new ideas. And she will tell you about the ideas. They are in this brochure. And so I hope you have an interesting hour, 2 hours, and when you have questions, feel free to ask whatever you need or want to know. There is no and never a silly question. Don't be afraid. And there might be a silly answer, and we both, three of us, do not want to give you a silly question, but just answer your question that you go home and say, I really heard something I did not know, or I learned something I did not know, or I have more clear what's happening to me and how I can handle this and how it will go on. So I want Dr. Schmidt to go on.
Yeah, well, once again, good afternoon, ladies and gentlemen. My name is Susan, and yes, first of all, I want to thank again to all those who made it possible to organize this wonderful meeting, thus giving us the chance to, yes, come to my beloved Sunshine State, Florida, and thus giving us the chance to, here we go, to introduce to you our clinic and rehab center, where we specialized on physical therapy and rehabilitation, and as you can see, it's situated amongst the beautiful Austrian mountains. Here we have focused on manual lymph drainage therapy, and to lead into this topic, I first of all would like to give you a short summary of the anatomy and the physiology, and I hope I won't be offending those who are quite informed in this topic, but I want to stay on a non-scientific level, not to tax those who have just newly been confronted with this. As you can see, we start with the lymphatic system. The lymphatic, whoops, that was me not being used to this thing. Okay, here we go. How does that work? Oh, this is the one. Here we go. Yeah, I found it. Okay. The lymphatic system, as you can see, is an additional vascular network starting blind in the superficial layers in the connective tissue, and then flowing to the lymph flows into larger vessels passing the lymph nodes, and finally ends in the left and right venous arc, thus having the connection back to the circulation. And as I said, they pass lymph nodes. What is a lymph node? A lymph node is a special filter station, and there are about 600 lymph nodes in our body. This is varying from person to person, and it's not like any other anatomy structure that is exactly at the same place and looking exactly the same, but it's very individual. Important is to know that especially where we uptake a lot of things from the outside, let's say breathing or eating, and the intestines or the neck region, therefore there have to be a lot of lymph nodes. Why? Because they are filter stations and lymphocyte producers, and they regulate the protein and water content of the lymph. And what is the lymph? You've almost probably have seen what the lymph looks like when everybody has ever had a blister. You know, this yellowish and sticky and sometimes clear, sometimes not clear liquid. That's a liquid that is somehow comparable to what the lymph is about. The lymph contains a lot of biochemical substances, especially proteins, enzymes, hormones, cells, and even sometimes foreign bodies. For example, a smoker has a lot of tar. As you can see, the lymph nodes close to the lung of a smoker is pretty black. And what happens? As you can imagine, the system is a very sophisticated system to have all the body liquids in a balance. And as you can imagine, once this nature-given balance is disturbed, an abnormal accumulation of water or fluid in the tissue results. This is what is called an edema. There are various kinds of edemas, like, for example, a disturbance of the fat tissue. The storage might cause a lipedema. If there's something wrong with the venous system, a phlebodema might occur. Others which are important to mention at that point might be a disturbance in the heart or the kidneys, which changes the water balance of the body. But the ones we are going to focus on is the lymphedema. To find my page, here we go. So, what is a lymphedema? It's said about to have 100 to 250 million people suffering from a lymphedema worldwide. Can you imagine? This is almost the population of the US. And the symptoms that are starting to show you there's something going on that is not meant to be this way is, first of all, the heaviness and the tension. And sometimes if the heaviness and the swelling gets so heavy, you might even have a restricted motion. In the beginning, sometimes it's still possible to do some pitting, so you can create little dimples showing that it's still soft. But it's organized into, or it's classified into primary and secondary lymphedema, which means a primary lymphedema is a developmental disturbance. That means you might have gotten it congenital or inherited, and it may show up anytime during lifetime. In comparison to that, a secondary lymphedema results of a mechanical insufficiency of the lymphatic drainage system. Maybe sometimes it was post-radiation, post-trauma, post-inflammation, after a paralysis, or any kind of mechanical hindering, like artificially by wearing whatever kind of extremely tight stockings or clothes. And to see it medically wise, we just have the symptoms posted into stages. As you can see, this is a primary lymphedema, and here with a little kid you can see it can already start in a pretty new or a low age. Even toddlers can have that. And the stage 1 shows, here you can see a swelling that is still reversible by itself. By lifting up your leg, doing something against gravity, then you can do that. Changing into stage 2 means that the so-called fibrosis, that is a change of the tissue in its consistency. Thank you. It's going to become harder. You're not anymore possible to just press and put little dimples, because it won't, because it's getting harder. And in the third stage, you can even have changes in the alterations of the skin, showing wart-like lesions, hyperkeratosis, and as a result of that, which is shown that the nutrition of the skin isn't the way it is supposed to be, infections like fungus or even bacteria can start, which would be another severe problem. This again, once again, is just showing the stages, but with the secondary lymphedema, this is breast cancer people. At the first stage, as you can see, almost nothing can be seen, though this has been operated on and the sentinel lymph node has been taken out. But then at stage 2, here you can see the swelling is getting worse, and this most probably in the lower arm, it's getting harder and stiff. And here you can even see the restricted motion and the change of the skin, and this has been a radiation case. Before the treatment can be done, a good examination has to be gone through, because the most important part before someone gets treated is a diagnosis. How do I get a diagnosis done? Is the case history. So it's important to tell the doctor or the physician or whoever's going to help you going through this, what happened, when did it start, how did it feel, has anybody else in my family had that before, is there anything I did that I didn't do before. So these information is very important to give to the person who's going to treat you. And then the clinic examination is going to follow by measuring the skin folds or by measuring the volume